Hello. Hey, I wanted to cover with you just very quickly what is essential care and what is being expected from essential care providers out there who are serving the public health emergency. So essentially, just so you know, I want to start with Perfect Companion, what's happening with the Perfect Companion, who's been deemed an essential service, not particularly obligated, but also just blessed to stay open, encouraged to stay out there to help the public, their clients stay healthy, safe, and also well cared for, and especially in light of social isolation. This could be very, very dangerous for an older adult that may have needs, both mental and physical needs. This is essential for the Perfect Companion to stay out there and serving in the homes, the clients that they're serving, and also to have that access to additional needs. So any other families who need to reach out, have an older adult, a parent, living on their own, or parents living on their own, they want to make sure that they're staying safe and in their homes, and also have someone taking care of their basic needs. So essentially, that's what Perfect Companion does. And here is an executive order. It was put out by Doug Ducey, but notice it's in light of the state of Arizona and the federal government. So this is deeming, there's actually 15 other pages of this, but it's pretty much deeming essential services, Perfect Companion being one of them. So Perfect Companion is out there putting their lives on the line. Their caregivers and the EVP, Concierge Care, Cassandra McCormick and John Siegel, who is the founder and president of the company, they're out there absolutely putting their lives on the line, following protocol, staying safe, and also because of their concierge approach of one-on-one care from the very beginning of when John started this company, that is absolutely being appreciated because they usually have one care provider caring for one family. So it's a very, very safe situation where you don't have someone coming in like a mosquito, helping you, leaving, and then another mosquito coming into your parents' household or your household. And also they're very accustomed to working in extremely sterile environments where someone's immune system is already compromised, or it's an extraordinarily nice house and they want to keep it safe. And in good hands. So that's where Perfect Companion comes in. And what's happening is they get to know their clients really well. And I want to give you an example. They get to know the clients, idiosyncrasies, everything. They've had this particular client's for quite a while. He's now 98 years old and very frail. Also has both physical needs, psychological needs, and things that are going on that might put him at risk, the family at risk, and also the care providers at risk. So it's very, very important in this case, and I'm going to use that word essential, that the caregiver that knows this client so very well stay with that client, because that client cannot be left alone for a minute. And care providers in the hospital, we have so much respect for them, but they don't know these little things. And under protocol, they're leaving both family members and our companion caregivers, the non-medical caregivers, on the street and somewhat being undervalued. So these are people that can help that patient care experience inside the hospital. They follow strict protocol, so they're not going to spread germs. They know how to act. They know how to be quiet during the doctor's visit and know when to speak, when they're spoken to, and how to stay out of the way and keep everything calm and happy. So in this case, even despite our client, who happens to be a lawyer and live in a different state other than his father lives in Arizona, we're here taking care of his father, but he's saying to the medical care, the institution that's caring for his father, please let the caregivers in from the Perfect Companion. My dad needs them. He's got severe needs and he needs them. Now, despite a letter like this, we're still left on the street. Kudos to the healthcare organization, though. We understand why they had to leave us outside with other family members as well, but also that they kept in touch. They understand the continuum of care and that last mile and how important it is for communication to stay open, and immediately upon discharge to have that care provider swoop him away and make him very, very safe. So I wanted to throw this out there because we're really curious about how this is going to affect things going forward. And we're going to ask questions of that nature, of the families that can afford this because it's out of pocket expense. It's considered a luxury to have a non-medical companion care and someone who's clinically trained to take care of your parents, but not administering medical care, and helping them stay fed and healthy and physically active. Like, that is considered to be a luxury item, not covered by insurance. So you families that can afford in non-medical in-home care, where do you see things going? What do you expect? We want to hear from you. We want to hear from you because we enjoy staying ahead of the market, and we want to serve you your dreams content. So please get in touch and let us know. Your thoughts can lead us to the next iteration of care coming down the road from this pandemic. Thanks so much, and stay safe, and I hope you appreciate the video.